So good afternoon everybody. Today my topic is an amniotic membrane umbilical cord graft reflecting new rays towards the glaucoma shunt surgery. I have no financial interest. Glaucoma drainage devices more frequently used in the treatment of uncontrolled glaucoma, and the tube exposure is the serious post-op complication that increases the risk of intraocular infection. Several patch graft used for covering the glaucoma shunt tubes, and the tube exposure rate reduced from 30% to 5% for the first 1 to 5 years, and the incidence of significant thinning and the melting of the graft 15% to 25% within 2 years post-op, and it is probably due to immune-related process and poor host tissue integration. So the why AIOC graft used, harvested from the umbilical cord with its compact structure and overlying amniotic membrane, high tensile strength, low immunogenicity, and excellent host tissue integration significantly reduce the graft thinning. So this is the video that's showing how the umbilical patch graft is processed from the donor tissue, and it is available as an amnio plus thick, and that is sterilized, minimally processed, dehydrated super thick human umbilical cord derived membrane allograft with a thickness 300 micron. And this is the histological pictures that shows the devitalized epithelium, compact stoma, and the basement membrane. And this graft is registered under Human Organ Transplantation Acts. So the objective of the study to determine the safety and the efficacy of amniotic membrane umbilical cord graft in glaucoma shunt surgery for reducing the glaucoma shunt tube exposure. It was a hospital-based prospective non-comparative interventional study and approved by the Ethics Committee of Institution and registered at Clinical Trial Registry India. Inclusion criteria: patient who had an uncontrolled glaucoma with or without failed trabeculectomy, and the age 40 to 50 years. Exclusion criteria: previous GDD surgery, chronic ocular inflammations, and no PL. So the method: the 50 eyes of the 50 patient with a refractory glaucoma underwent glaucoma shunt surgery using Ahmed valve, and the tube is inserted into the anterior chamber and the pars plana, and the tube are covered with an AIOC graft, and the period of study 2.5 years in AIOC, Kolkata. So this is the surgical technique. Before implantation, the graft was rinsed and reconstituted with a balance on solution 20 minutes before surgery, and then cut into the rectangular shape 5 mm into 7 mm, and then it's placed over the tube portion of the valves and secured to the underlying sclera with a 90 nylons. So now come to the follow-up. The patient were examined on the first post-op day, then 1 week, 3 months, 6 months, 12 months, 18 months, and continue. And the AIOC were assessed to assess the patch graft thickness, stability, and the host tissue integrity. So the main outcome measure including the tube exposure, graft thinning, and the graft-related complication, and the secondary outcome measure other complication related to the tubes. So the early graft thinning is defined as more than 20% reduction of the graft thickness at 3 months. So this is a subjective demographic and the preoperative characteristics. Now come to the result. Out of the 50 patients, the 6 patients developed early graft thinning, and the 2 patients developed late graft thinning, 1 patient developed tube erosion, and none of the patient developed any complication. So this is the changes of thickness of the AIOC graft. At the 1 month, the is 40 micron and average thickness, and the 18 month the average thickness was 274 plus minus 15 micron. So this is the sequential AIOC picture. At the 1 month, there is a gap between the patch grafts and the conjunctiva, and within the 12 month, the graft is well marked with a subconjunctival space with a maintained thickness and increased reflectivity that indicates the excellent host tissue integrations. And the 12 months, the AIOC covered area is an aesthetically more appealing. So this is an AIOC picture of the tube exposure. And next is a sequential AIOC that's showing the late graft thinning. So as per the published literature, several patch graft used for covering the glaucoma shunt tube surgery, the donor sclera tube exposure 26.8% in 2 years, and the endophthalmite is 1.7%, donor pericardium tube exposure 7 to 15%, and progressive thinning 28%, amniotic membrane tube exposure 3.43%, and the corneal patch graft tube exposure 2.5%. So the AMUC patch graft, the tube erosion is 2% and endophthalmite is nil. So this is another study that was published in Ophthalmology Glaucoma 2019, and the purpose of the study to compare the long-term safety and the efficacy of the amniotic membrane umbilical cord and the pericardium patch graft in reducing glaucoma shunt tube exposure. So the conclusion of the result of this study is tube exposure occurred in the 2% in the AMUC group, and the incidence of the early graft thinning only 12%, left graft thinning 5%. In my studies, the 18-month follow-up, early graft thinning 12%, left graft thinning 4%, and the tube erosion 2%. So the AMUC grafts are well tolerated, and its high tensile strength, low immunogenicity, and the excellent host tissue integration property excel long-term graft survival. And this is a treatment of option especially beneficial in the limited donor cornea and the eye banking services. These are my references. Thank you.
One thing, you are already a faculty member in a medical college. In PPT, you have put full stops everywhere. Don't you know that they are not supposed to be put?
So this is not other presentation.
Full stop is supposed to be used when there is a complete sentence and in case you are writing a text. And in PPTs, you are supposed to make only points.
Sir, this is not the original presentation. Oh, there's some mistake.
No. Chalo, anyway, that's for us to judge. But any
What was your, like in your own institute, before you used this graph, so you were using scleral, must have been using
Scleral patch graft also
what was
used.
your tube erosion and rate? You compare your own rates with this rate rather than comparing with the...
The tube erosion rate is more in the scleral patch graft, and there is also endophthalmitis is more in scleral patch graft.
What is the rate?
Incidence rates are more than 15% in tube erosion.
How many years after research?
I have done 3 years. 3 years searching.
Why that would have been better, like if you...
Yes, the COVID situation when there is a scarcity of the eye banking.
Other factors which determines the tube exposure, especially
Tube exposure,
A3 size.
and especially tube exposure more occur in patient with an chronic uveitis, so secondary glaucoma. This patient may have more prone to develops, and also the patients who had a number of multiple surgery previously done, and also in my study I seen that there is a female object more prone to develop tube erosions.
you have shown 26% as a tube exposure incidence, which I can't digest because I have been doing walls. I think I must have done more than 150 walls by now, and I have seen tube exposure in my cases only in 3 cases.
But this literature said
and I have been doing it for a very long time. I have a long, follow up, and then generally those 3 cases also which I had, they were only in the beginning. There's only one case in which it really melted, the sclera melted, maybe some autoimmune reaction and all this happened, but at 26% of incidence is very difficult to digest.